Hi everyone, this is Dr. Pete, and I'm jumping on the mic to talk about 3 tips to address your shoulder pain. The shoulder is a tricky area to treat because it consists of a lot of body parts. It consists of 1, the shoulder blade, 2, the thoracic spine, 3, the lumbar spine, and then 4, the actual glenohumeral joint, which is the ball and socket. So you can see there's a lot of areas to consider if you have shoulder pain. A few things that I see that we can miss with addressing shoulder pain is looking at either the lumbar spine, which is the low back, the thoracic spine, which is the mid back, the scapula, which is the shoulder blade, and then 3, the actual movement of the shoulder girdle. Here's a few things that I like to look at whenever I address shoulder pain. So first, I like to have my patient sit, put arms above her chest, and rotate side to side. Some stiffness in this area can show that there's some tightness to the thoracic spine or the lumbar spine. If there's tightness in that area, we could address that with treatment. The second thing I like to look at is shoulder mobility. So the shoulder moves in multiple directions. It moves up overhead, it moves up to the side, it internally rotates, and it externally rotates. This combination of movements allow for the shoulder to move and manipulate objects from overhead and throughout the environment. So that's the second thing we'll look at, is the actual shoulder mobility itself. Third thing is, let's go ahead and just jump into some ideas to address for potential treatment options if you do have shoulder pain. If you have stiffness in the mid back or low back that's influencing the shoulder, I like to implement what's called a thoracolumbar stretch. That's gonna look like this. You'll lay on your back, you're gonna pull one knee over your shoulder, let this other shoulder rest to the floor, and take a nice deep respiratory breath. And you can alternate from side to side. That's one area of treatment for shoulder pain. The second one is actually looking into that overhead movement. You could do that what's called a child's pose stretch or a prayer stretch. You can come up to a wall or a rig, grab onto that rig, shoot those hips back, thread that head through the needle, take a nice deep breath. What you'll feel is often a stretch throughout the lats. The lats are a really big, broad muscle group that attach from that mid and low back area, and it comes all the way across and attaches here. Oftentimes people get a lot of pinching sensation through this area, and that can influence shoulder pain. The last thing I like to look at is actual shoulder mobility and scapular control. Oftentimes we jump to the point of exercise before getting to the actual reason of why we have symptoms, but scapular control is the last answer or the last solution to addressing that painful shoulder. What you could do, grab a band, take a step back, and work on scap squeezes. So letting the shoulders reach and then squeeze, hold for 3 to 5 seconds, reach and then squeeze, hold 3 to 5 seconds. You can do that anywhere between 5 to 6 reps. What that will do is help increase the control to the scapula while you're having a painful episode, so you don't lose strength during pain. If these 3 tips don't work for you, schedule an appointment below so we could address that shoulder pain in a future treatment. Thanks, guys.